Hello, and welcome back to this episode of This Healthy Life podcast. I'm so excited for my guest today. This is someone who is near and dear to my heart and helped me on my own lipedema journey. I have my surgeon, Dr. Thomas Su. He is the owner of ArtLipo, and he is a cosmetic surgeon here to share his wonderful technique on how he's helping so many women with lipedema. So, Dr. Su, thank you so much for joining. It's such an honor to have you on my podcast.
You're very welcome, and it's a pleasure, my pleasure to be here.
Awesome. So I'd love for you to start just with a brief intro about yourself and how you got into working with women with lipedema.
Well, the way that I got into it was by chance. I've been doing liposuction now for 19 years, and somewhere about 12 years ago, it was 2011, 2012, I started doing something quite a bit different from what other doctors were doing. So every doctor's taught that when they're doing areas like the arms, it's just doing a little bit right here, and it's not going all the way around. In fact, they tell you can't do that. It's impossible to do it safely or to do it with a good cosmetic result. So in 2011, I was the first one to take that chance and do it with a patient who had actually requested it, and it turned out great. So thus was born 360 high definition arm sculpting. And after I worked on that for a couple of years, I think it was about 2013, I started writing a book about it. And around the same time, which I'd already been doing liposuction for about 8 years at that point, and had about one case of calves and ankles a year. That's, as a liposuction specialist, probably about how often someone comes to you and asks, can you do my calves and ankles? So I had never turned anyone down, and I'd done about 8 cases. But for some reason, this year, around 2012, I had 3 or 4 cases that were relatively close together. And here I was promoting this new way of doing 360 circumferential arms. And I was just getting into social media and putting things on YouTube and Instagram. And I said, hey, why don't I, do some posts about doing calves and ankles? And at first it was really a very negative thing because all we got were negative comments, people heckling us saying, oh my God, cankles, and ridiculing us. I almost took it down, and I'm glad I didn't, because we were really starting to market pretty successfully with the arms at that time. And we put it kind of like in a mixed type of post, and slowly started picking up. So thus was born probably one of just a few specialists in doing calves and ankles. So back in 2013, when I started doing that, and I looked online to see who else was doing it. Well, really, Dr. Amron and Dr. Marcia Bird in Georgia, and myself. And maybe one other Dr. Copeland, who was a plastic surgeon, who popped up. There's 4 doctors that there were websites for advertising calves and ankles. So that's where I started really specializing in the legs and doing it a different way, doing a 360 calf, ankle, and knee. And it built up fairly rapidly along with my arms and became my specialty by about 2015. So I've been specializing in these areas and doing it 360 longer than anyone. I mean, even Dr. Amron and Bird, they weren't doing circumferential arms. And so I proudly say I am the one who invented 360 circumferential arms and used that same type of technology and techniques to do the legs, the lower legs initially, and then gradually it became the upper legs too. So how did it progress? Well, I didn't know anything about lipedema back in 2012. And I'm going to venture to say that Dr. Amron wasn't doing lipedema at that time, or Dr. Bird either, because I would visit their sites and see, what my competitors were offering. And it was sometime, maybe a few years later, that I think all of us kind of found out about lipedema and started treating it, because in the early days, lipedema was felt to be a disease that affected the lower legs, causing that calf and ankle thickening. And that was the only type of lipedema that was identified before. Now we have multiple types that involve the upper legs, the abdomen, waist, the upper body and arms. So in the early days, it was really just about the calves and ankles. And myself, I had been specializing from 2012 up until 2017 is when I learned about lipedema. And it was the way that many doctors these days is learning about it, because a patient of mine came in and we're doing her calves and ankles. And she said, Dr. Sue, do you know what lipedema is? And I said, no, I don't. You mean lymphedema? The response that I think most doctors have.
Mm-hmm. It's easy to confuse the two, right? When you don't know too much about it.
Exactly. Mm-hmm. And she ended up giving me literature from one of the foundations. I can't remember which one it was, but she gave me a brochure and a booklet. And when I was doing the case with her, I really didn't know what to think of this. And until I read through the booklet, I was pretty skeptical that a disorder of the fat really existed that could cause all these different problems. So that was 2017. And here we are 8 years later. But the important thing is that I had already been specializing in the legs and arms for 5 years before that, and specializing it in a way for cosmetic benefits. And when I started learning about lipedema in 2017 and saying, okay, well, how is liposuction different for lipedema patients? And the one thing I realized that even early on was that it should be more complete to improve the symptoms as well as prevent the symptoms or the growth of the lipedema fat. So that part was clear, but there was other challenges, because early on there was more literature and maybe there was more statements from the initial researchers saying that you had to do it with lymphatic sparing liposuction. I didn't know what lymphatic sparing liposuction was. In fact, if you go out on the internet today, even after we've had a lot of time to learn about lipedema, there really isn't any good definition of lymphatic sparing liposuction. So I made it a point in 2018 to go and visit with Dr. Joseph Stutz in Germany, who was one of the original doctors who had researched and came up with doing liposuction for lipedema. So I don't want to spend much time on lymphatic sparing liposuction, because I don't think there is a good technique that anybody can say this is what it is. But in general, you want to use smaller cannulas, which just makes sense if you can, to not be as aggressive and not to disrupt structures of the fibroseptal network, that if possible, and not to disrupt lymphatic structures.
Mm-hmm. But you're already so compromised with lipedema anyways, right? I mean, you're already suffering from issues with your lymphatic system and swelling that is just going to aggravate it even more.
And to date, there is still no good study showing that there is any significant damage from liposuction, or comparing the different types of liposuction or instruments, including the water-assisted liposuction, the commonly used power-assisted liposuction, which I myself use, as well as Vaser liposuction, which is an ultrasonic technique, compared to just suction-assisted liposuction, which is just a normal cannula with no assisted power to it. So there is no study that documents or looks into whether these different modalities have any differences, or the different size cannulas. So everybody out there is doing what they feel is the most effective way of removing fat themselves. When I say everybody, I mean all the different surgeons, of which I think only about a dozen of us have been doing things for more than 5 years, more like 5 to 7 years, 8 years maybe. The other 20 or 30 doctors that I think are now in the field, seems to me they've only been doing it for about 2 or 3 years. And every one of us has had to figure out what works best in our hands, in each of our own hands, because there's no school teaching liposuction to doctors who want to perform liposuction on these lower leg areas, these upper arm areas.
Or even for lipedema, right? Like there's not really even any lipedema doctors other than surgeons really. And just like, I think we talked about this when I was having my surgery. It's like, there's no fat doctor, right? Like there's no doctor that you're like, hey, I'm having a fat disorder or something's going on with my body. Like who do you go to for that?
There's no one specialist that knows more about lipedema, because nobody is taught in med school or in the residency programs about lipedema. It's, and I've been saying that for a few years, and I may be wrong, because maybe there's a med school out there that has started now. Maybe. I haven't heard of it. The plastic surgeons, from what I'm aware of, have just been introduced to lipedema at their annual conferences. In the last 2 years, I think there were lectures about lipedema. So that's a great place to start, because that's the largest group of doctors who are doing liposuction. And now that they are recognizing, that's the majority of the newer doctors who are coming into the field. The last, 20 or 30 doctors that I've seen pop up on the internet have all been plastic surgeons who are now becoming aware of this. Myself, I'm not a plastic surgeon. I belong to the American Academy of Cosmetic Surgery, who supports doctors from other backgrounds into doing cosmetic procedures. And that includes doctors from general practice, like family practice, internal medicine. It could be gastroenterology. It could be radiology. So many doctors are now getting into different types of cosmetic procedures and doing liposuction. So I haven't seen any new ones come out, but the ones that I was talking about, the core 10 to 12 doctors that have had the most experiences doing calves and ankles and lipedema, I would say have been those outside of plastic surgery. Because I'm going to say, myself included, we've, as alternative cosmetic doctors, have been more involved in liposuction, one of the fewer things that we can get into without doing breasts and facelifts and other things. So my practice has been solely geared towards liposuction for the last 19 years. And several of these other doctors, I think Dr. Amron was heavily involved with liposuction, Dr. Bird also, Dr. Thomas Wright. So all of us are kind of from alternative backgrounds.
But been doing it so long, a lot longer than a lot of the new doctors, right?
Yeah.
And that experience is so valuable, and learning as you go. So
what other questions? I mean, that's kind of like the general background.
Yeah, no, that's great. That's a good background. So I want to talk a little bit about your technique. Another thing that's very special about your technique as well, which is doing awake lipo. And, I think a lot of people hear that and freak out, but really it's not so bad. I had 4 awake lipo surgeries, and, I am very happy with my results and that I went through that. And what are some of the benefits of doing it awake? Obviously anesthesia is very difficult for people, some more than others. So that's a benefit of not having to go under anesthesia, but there's also some aesthetic benefits that you get from doing it awake and being able to kind of be interactive with your surgeon. So I'd love for you to kind of share some of the insight that you found from doing awake lipo and what those benefits are.
Yeah. Well, everything that you said just now is absolutely true. Not being a board certified plastic surgeon, I learned the technique that was available to me, which was awake liposuction. It's called tumescent technique, and it's actually been in existence almost as long as liposuction under general. So liposuction under general, as developed by plastic surgeons, has been around since 1981. Tumescent technique, which was developed by a doctor who was triple board certified. This is Dr. Jeffrey Klein, who was certified as an internist, dermatologist, and pharmacologist. He's the one who developed the technique of tumescent liposuction. This is using a fluid that we inject into the fat layer prior to doing the liposuction. And this fluid is basically a bag of saline with the addition of a portion of lidocaine. Big bag of saline, small bottle of lidocaine. So with this very diluted solution, and there's also a couple other ingredients. There's there's epinephrine to help keep you from bleeding. And when you inject this into the fat layer, it pretty much numbs everything in a very good fashion where patients can tolerate very well. I'm not going to say that there isn't any discomfort, but it's very safe. And besides the safety aspect of it, which I'll touch on here, tumescent technique carries some risk of toxicity, which can be easily avoided by staying away from the highest limits of lidocaine. And that we can easily calculate beforehand. And by breaking up your surgery into multiple parts, I rarely get anywhere even close to our limit of lidocaine for a day.
Not even with me.
Even for our largest patients, because our small or medium-sized patients like you, we break the legs into 2 surgeries. And for our large and very large patients, I've done many patients who we break up into 3 surgeries. I think maybe one patient that we've had to break up into 4 surgeries. So the largest patients I'm talking about are about 280 pounds. And so when we break it up into those multiple surgeries, we can still stay nicely below our lidocaine limit and in the safe range. Now, if you compare that to general anesthesia, there are issues of neurotoxicity where people can have their nervous system affected. It can cause problems with fluctuations in the blood pressure, which can stimulate cardiac problems like heart attack. So patients who are elderly or have more complications of their medical issues like high blood pressure, diabetes, who are risk for stroke and heart attack, they have to be very, very careful when undergoing general anesthesia because there is that risk. And more, we have to treat patients with lipedema who have these types of medical conditions, whereas cosmetic doctors typically didn't have to worry about that because we weren't seeing complicated medical histories. But now that lipedema is it's the majority of my cases, I see probably 80% of my patients are lipedema patients now and 20% cosmetic. So in any case, safety is a very important thing, which tumescent liposuction has a lot of benefits in. So getting back to Erica's question about, what are some of the other advantages for the lipedema patient? Well, lipedema is a type of issue that the liposuction has to go all the way around the legs or the arms. There are a lot of positions that I need when I'm sculpting the patient's laying on the table and I'm going on the back side of the legs. I can rotate their legs some and I can lean over and I can work a little bit underneath, but I can't get all the way around. And especially I can't get there in a good way where I can remove the fat smoothly and effectively in a compromised position. So what do? I turn the patient and I turn the leg this way and I have the patient hold their legs in a tensed fashion. So, the leg is loosey-goosey and then I say, tighten up. So now everything
it's quite the workout.
tight. Erica's been through this. Throughout the surgery, once I get my patients in position, I'll say tight. And there are many advantages of having the patient awake. So getting into position is just one, okay? Getting into the optimal position. Well, getting there is having the patient move. But now that you're there, you want them to hold it still. So if a hairstylist was trying to cut your hair and your head just bobbing and weaving around, it would be very hard for them. So they, you hold it still when you're having your hairstyle so that they can work around. Well, same way with liposuction. By tensing up your muscle, now I can grab that fat and I can work at it in a way where your body is still. And that's why I say tighten up the body. But in liposuction, the fat layer that we're working on, it's loose. And as you're pushing through this, you want it to kind of stay still so that you can move across it smoothly. And the problem with that fat is it has a lot of fibrous structures, millions of little strands going from the skin down to the muscle. And the fat's clinging onto these strands, and we're trying to break it free. So as I'm going back and forth, things are grabbing and tugging, and the cannula wants to move not in the same layer, but it wants to get up and down and move in different ways that if you were to just remove the fat continuously like that, you would end up with a wavy removal of the fat. So when I have my patients tense their muscles and I grab, everything tightens up. And then I have a firm surface that is not loosey-goosey, and I can move in there and I can move across it in a back and forth fashion, which is in a plane. So I think that in the realm of liposuction surgeons, that I achieve much better cosmetic results than most doctors.
100%. For sure.
It comes down to technique.
Mm-hmm.
If you cannot control, liposuction is all about control, whether it's for lipedema patients or it's for cosmetic, but especially for cosmetic. If you don't have good control, the end result is someone who has had fat removed and it's lumpy and bumpy. So everything in the cosmetic realm is about getting it, removing it smoothly. Then add in the factor that we really need for lipedema patients, completely. So not just smoothly, but completely. So now we've got to work it smoothly, got to work it down, full thickness of fat from top to bottom. And it gets more and more difficult as you remove it because now things become more loose. And when it's loose, the skin's bunching up and doing all sorts of weird things. So it's a real struggle for all doctors to remove things completely and smoothly. I think I do it very, very well, much better than most, but it's because of the technique that I have where my patients can tighten up their muscles, which tightens up the fat and gives me better control.
Which you only get with awake lipo as well, right? Yes. I mean, when someone's under anesthesia, there's no way that they're going to be able to be doing any of that tightening or do that. And those results aren't as good
for you. So the doctor has to, with their assistants, try to turn you. And because it's hard to do, they're going to move your body in much more limited fashions. And then they're going to work from more compromised positions. And they're not going to work it all the way around. Many doctors that I know who do this under general talk about doing it frontal and the front first.
One at a side, one
front
time.
of your legs, and then the back of your legs. And I'll explain why that is. When you're under general anesthesia, you're intubated. That means you have a breathing tube that goes down into your throat, and you're on a machine that controls your breathing. And in order to do that, where you're not tensing up and fighting this machine, they have to paralyze your body. So they give you a medication that paralyzes all your muscles.
Wow.
In any case, with this tube coming out, it has to be managed because if it gets kinked, you're not breathing. So when you're laying down and everything's set up in one way with the tube, if the doctor said, well, we need to move the patient and flip him over, it's a real ordeal. It can be done, but a lot of doctors don't like to do it because it takes a whole team of doctors and nurses to flip your body over. Now they have to make sure that your head is in the right way, the tube is in the right way, and they have to reset everything so that from an anesthesia standpoint, for a breathing standpoint, nothing is compromised. So I think most of the doctors that do it under general anesthesia, they want to do the front side, set up one way, have you come back another day, flip, start you off, turned over. And I think, just my opinion, that trying to blend things from the front around and then coming back and blending it from the back side to the front tends to leave fat on the inside and the outside a little bit more than we would want it to, because you're having to work into those areas to blend it back each time or the second time you do it, you have to blend back into the overlap the first area so that you get it. And I've seen a number of cases that have come to me as redos that were done like that. And I've come up with my opinion because I've seen more fat left on the inside of the thigh and calf and ankle and on the outside. Why was I redoing it? Because the doctor did not remove things as completely as I'm going to say not possible. I mean, doctors stop at all points along the way. Liposuction is not an all or none surgery. In many cosmetic surgeries that I've seen and had to redo, the doctors removed as little as 30% of the fat. So when I say 30% of the fat, you have a thickness of fat. And if you remove 30% of it, it's like this. It's a third of the fat. And for a cosmetic case, they call that conservative removal. And maybe, that's enough to see a cosmetic difference. And I never felt that it was. And I've always tried to remove somewhere around the 70, 80%, even up to 90% of the thickness of fat, which becomes much more difficult, not just to remove it, but also to keep it smooth as you remove it all the way. So in my lipedema patients, I try to remove about the same. And I would say the doctors that are coming more recently from a cosmetic background and not used to treating lipedema patients may only remove 50%. And that's very common in the cosmetic realm, but it's not, it's not as complete as I think is important to do for lipedema patients.
And then, because you run the risk of it coming back, right? Or growing more
Correct,
in the same
yes.
areves and then having to do lipo all over again instead of just getting it out to begin with.
Even when I did things for cosmetic patients, they would always ask me, well, can this come back? And I'd tell them, I've been doing 19 years now. I've had very, very few patients that have come to me and said, you know what, my fat's come back. And the few that I've seen, it's come back a little bit. So anytime you leave any fat, even if it's 10% of that fat, theoretically, it can come back some, but I'm saying 19 years of doing liposuction,
doesn't come back
very
much.
few cases of people coming back to see me because I've always done it on the more complete side. If you compared that to someone who only had a 50% fat removal, they had 50% of their fat remaining. I think if they gained a little bit of weight, those areas could come back fairly easily. So the more complete you are, the less chance it's going to come back.
All right.
Yeah, and I've heard one of the doctors, I won't mention names, but one of the doctors that does plastic surgeon that does lipedema, and he's in videos talking about how there are studies showing that 30% fat removal is enough to remove your symptoms, and I just don't think that's.
I don't believe that. Someone
he's quoting a study, and I don't know where the study came from, but even if it did remove your symptoms, and I think the point was it removed your symptoms as well as if you did it much more completely. And I've never done that study myself, and I doubt if that is true. I really doubt if a partial removal, a small 30% is going to be as symptom relieving as a 70% removal. I highly doubt that.
Absolutely. And then, so I want to talk about skin tightening a little bit too, because, you're taking out a lot of fat, right? So there's a possibility that you're going to have some looseness in your skin. And, but the way you've done your technique is the skin retracts actually quite nicely. And with the compression, that helps as well too. So can you talk about some of your technique and how that helps with skin tightening and where one might have some issues with skin looseness?
The way doctors are taught liposuction is vastly different than how I do liposuction now. And I've developed a technique where I work very close to the surface of the skin. So if you picture, okay, this is the skin, and this is the muscle, and this is the fat in between. Doctors in general, plastic surgeons, non-plastic surgeons, the teaching out there says, go down deep, get the deep fat, try to leave the surface fat alone, and don't spend any time working up that near the surface because you'll injure the skin. This is how almost all doctors are taught. And as they progress and when they are thinking that they need to get things more completely, automatically have to start taking not just the deep fat, but quite a bit of the mid fat and starting to come up toward the surface. You can't get to fat completely if you don't come up close to the surface. But I'm just talking about how doctors are taught, and many of them take that dogma, there's that teaching, and they, for their entire career, they never work up to the surface. I started working up close to the surface because I was doing things very completely, even in my first couple of years. I never believed that you should do a conservative removal if you were trying to achieve a nice result. So even my first 2 years, I was working close to the surface, and I was seeing a great amount of skin retraction, especially on the tummy. Those days I didn't do legs and arms. I was doing tummies. And I had an older population where I was working in Newport Richey, Florida, which is a retirement area. So I had 50-year-olds and 60-year-olds doing tummy lipo, which is kind of unusual because in just about every other part of the country, your cosmetic doctor is working on 30-year-olds and 40-year-olds who have good skin. So as I was removing the fat, and we didn't talk about the last one of the other benefits of being awake. You can stand up. So when I'm done with an area, I know that gravity is going to affect how it looks, and I stand patients up in front of the mirror so that they can see the results, and we see how it's going to look immediately, because by that time 80%, 70, 80% of the fat's gone, along with 70, 80% of the fluid that we put in. So some people say, oh, well, it's still puffy and everything. How can you see anything? No, we remove it so completely that you can see how it's going to look.
It's pretty amazing. The one leg done is
if you watch
so
my
dramatic.
Videos,
it's amazing.
Everything's removed so completely.
Yeah.
But that's the point. When you stand someone up, you can see it. And in some of my videos, I'm seeing for the first time too. I go, oh, yeah, there's still a little bit here. Okay, yeah, we'll get it, when we lay you back down. Well, in doing the tummies, it was a great learning experience because I had a lot of older patients. And when we stood them up, the skin and fat would go into a flop down at the bottom. And I go, okay, there's still some fat there. And I'd take it more. And I'd have to go even closer to the surface. And I'd take it more and more and more. I found out, it took me a couple of years to realize why my patient's skin was pulling back so tremendously. I mean, we had patients who had their lower part of their tummy. Let me stand up here. The lower part of their tummy, where it goes into a hang. Mm-hmm. Sorry, I can't show that too well, but it goes into a hang where you can put your fingers up underneath it. We call that a pannus. Mm-hmm. And that's the type of patient that almost every plastic surgeon is taught, okay, cut it off.
Tummy
do
tuck,
a tummy
yeah.
cut. Mm-hmm. Well, not being a plastic surgeon and not being able to cut skin away, I said, let's take the fat away. And when I was taking the fat away on these patients, I had quite a few. If they had a pannus hanging down an inch, they would go away almost completely. I had some that had hangs down 2 inches that pulled up completely too. Many of them would be not complete, but most of the way. So I learned to know how much skin can retract. And going back to Erica's question, like when we do these large lipedema patients, how can we get great skin retraction? Because this is counterintuitive, but I'm removing it very completely. But even more so, I'm removing it very close to the surface of the skin, which doctors are taught never to do, but I've been doing for 19 years, and I can say that it's very safe. You have to be practiced at it. You can't just go and poke into the skin and hit the skin. You can injure the skin that way. And my technique is very specific. It's cutting across that fat in a layer by layer fashion, whereas other doctors are just going back and forth in kind of a haphazard way. I hate to say it, but doctors are not taught how to sculpt. They are taught this is how fat it comes out, and it's a debulking method. Most of what I've seen out there for cosmetic liposuction is what I would call debulking, going in and just kind of working an area to take away fat to flatten a hill. But when you have to sculpt, it's a whole different thing. It's about changing a shape of something and doing it very intentionally and doing it very completely. So with the liposuction very close to the skin, as well as sculpting everything very completely, we get to see the natural ability of the skin to retract. And it's something that most doctors, again, they never have learned that the skin can retract that much. And I wouldn't know it, except that I've been doing it for 19 years. And I'm still surprised sometimes, when I have a really large patient who's almost 60 years old, already has floppy folds in their inner thigh, and I take it all out and it pulls in and it looks better and tighter than it did beforehand. Not every case, but many cases are like that. And it surprised me many times. Even 19 years into it, I go, oh my God. The next day when we get to take the garment off and see how much is retracted, I'm still surprised many times.
It is pretty impressive, right?
Pleasantly
Especially after
surprised.
just going through that and removing so much fat. And it is really impressive just how resilient your body
what
is.
I always tell patients that the first, right when we're finished, if it is a 50-year-old patient or 60-year-old patient and they lift up their leg and underneath their calf, they can see the skin hanging down. It's floppy like this. And I'll tell them, listen, by tomorrow, whatever you see right now, half that hang is going to be gone. So 50% of that looseness is going to be gone by the next day, which that's a general rule, and it almost never fails. But sometimes it has gone and retracted up 70%, 80%, 90%. So that's why I'm saying, I'm surprised many times, but I know it's going to pull up at least 50%. And the lower leg, the calf and ankle, does very, very well. I'm not going to say there aren't some wrinkles on the backs of the calves at times, but compared to the upper thigh and knee area, it usually looks very good where it's hard to see the wrinkles. In the upper leg, I have a lot of patients who are older, really a lot of bulgy, fat that's in rolls, especially above the knee, inner thigh. So I don't expect it to, look great in these cases, but I do expect the skin to pull back tremendously. And out of all the patients that I've done, the upper thighs, where you could possibly want a thigh lift, I'm going to say the percentage of, patients who are older and with looser skin, it's less than 10% that would have pursued a thigh lift afterwards.
Yeah, I was pleasantly surprised with mine because, go ahead. Yeah.
Yeah, the 90% are usually pretty satisfied, going, oh yeah, I can live with that. I can live with some wrinkles there.
Yeah, I had thick thighs for sure, like when I came to you, and I'm very pleasantly surprised at the size they are now and how much the skin has retracted, and that I don't really have like too much looseness. There's like a few areas, but I feel like everyone at this point has, my age has some kind of skin looseness going on, so it doesn't look like anything.
Well, you're one of my younger patients.
I feel like I'm older.
Or let's say at least in the middle range, because
yeah.
The youngest would be like 20.
Yeah.
But I would say the average age is somewhere in the 40s and up. Patients in their 30s aren't, too many.
You don't know what's wrong going on yet, right?
But yeah, if you're in your 30s, your skin's going to pull back. Excellent.
Even better.
Yeah. And
if you're able to find out that you have lipedema by the time you're in your 30s and do something about it, I feel like it takes women so long. Like me, I didn't find out till I was in my mid 40s, right? So it's like, and I did something right away as soon as I discovered it. But
I was thinking you were in your 30s still.
I know. I wish. And then, so I want to talk a little bit about some of the non-surgical kind of wins, right? Like we've talked a lot about like some of the aesthetics and things that can happen. And especially in the lipedema community, there's a lot of things that the lipedema is doing to impact like our health, right? It's causing pain. It's causing severe bruising. For me personally, I had a really hard time building muscle and working out at the gym. No matter how hard I worked out, I couldn't build muscle. And I'm lifting the heaviest I have ever lifted in my life. And the only thing I've done different is have surgery to remove the lipedema. And, I know we've talked about like grip strength too, with like the forearms, like that went up, but I'd love for you to share some wins that you've heard from some of your patients that, after surgery, what are some big dramatic shifts that they've had in their life after having lipedema removed?
Well, I'll start with the general first. And out of the main symptoms that women have, let's call pain and tenderness 1, we see really large improvements in pretty much everybody who definitely has lipedema. When I say really large improvements, 60 to 100%. 60 is like, it's uncommon to have someone who says, oh yeah, it's better, but there's still a lot of it there. Usually, so a lot of patients, 80 to 100% improvement in their pain and tenderness. Next one, heaviness or fatigue. Similar, 60 to 100%. There's always a huge improvement there. Right when we're done, patients lift their legs, they kind of march in place in front of that
so
mirror,
light
and
compared to all the weight you've been
can feel that
carrying.
lightness right away. And I don't believe that's just from the weight of the fat. I believe that the functioning is already improved in the muscles. It's just an immediate thing. The third symptom that I like to concentrate is swelling, right? Well, swelling is the one I like patients to understand. It's a inconsistent thing. I don't know how other doctors are on this, but I have some patients that have zero improvement in their swelling, and I have some that have 100%. So it runs the whole range. And my understanding of this is that there are just different reasons for edema. Lipedema is one, and it's not the same. It doesn't cause the same type of edema as other medical conditions. And many women throughout their entire life without lipedema have swelling from the time that they're in their teens, especially around menstrual periods, certainly with diet and just standing all day, so you don't have to have lipedema to have swelling in your legs. I think some of that is just normal. So in any case, and then there's, as you get older, vein problems, we call it venous insufficiency, where veins don't return the blood as well and they become leaky and they allow fluid to get into the surrounding tissues. That becomes much more common. So we see a lot of women who have lipedema who have, sometimes it's the largest varicose vein. Sometimes it's just a lot of smaller, medium spider veins, medium and large spider veins. So anyways, swelling is the one that's least consistent. So getting to what Erica was talking about, this is a really exciting type of thing that I've been seeing, and I have given talks about, and that's about strength. So if you're reading about lipedema, everybody's come across, talk about how fatigue, heaviness and fatigue are improved. And it's usually discussed in that way that, lipedema causes fatigue. But there's a difference between fatigue and all-out strength. Fatigue is really a function of strength over time. And it's hard to measure, fatigue. But strength is about, okay, how much can you lift, or how much force can your muscles create just in a static, tensing up. It's hard to measure in many cases, but it can be felt. And what Erica was describing, that she's the strongest she's ever been, I've seen that over and over again in my patients who are coming back for their second surgery. We typically do the lower leg and knee, ankles and knees first, and then we have our patients come back for their upper thighs second. That's generally, it doesn't have to be done that way, but that's how most of my patients are. So when they come back for their upper legs, I've had a chance to talk to them. How's everything going? Are you feeling any different? Are you going to the gym and noticing any difference? And many, many times my patients say, oh yeah, it's much easier in the gym. And if I really, kind of ask them, be specific, are you lifting more? Are you doing more? Yes, I am. How much more? And over again, I've heard a number, close to 30% improvement in the amount of weight that someone's lifting. And I wouldn't be asking all these questions if I hadn't already seen something that was even more suggestive of pure strength. And that is the forearms, as Erica was talking about, because about 3 years ago, I had a patient who asked me if her weakness in her grip would improve when I did her forearms. This was a lipedema patient. And I told her I didn't know. But as soon as I did one side, she goes, oh yeah, my strength is so much better. It's really back to normal. And the same thing, both sides were consistent. And after that one patient, I began asking patients when I did their forearms, do you have any weakness of your grip? And about half of them had, they said, yeah, I do, think that my grip is weak. Every one of those had improvements right away, immediately after, oh yeah, it's stronger.
I know we tried to measure mine the day of my surgery. I remember you couldn't find your machine. We were going to try to measure it before and after, but
and someone gave me one, and I still haven't ever used it because I didn't have batteries, and then it wasn't working. But
That'd be a cool thing to measure before and after surgery, right? To see how much that
I
shifts.
shared with Erica something. I don't know if I can't remember now when your surgery was, but it was the end of 2023. November 23 was the first World Congress on Lipedema in Potsdam, Germany. And up until that point, it was about a year before that I had to think of, a topic to present. And I was given the privilege of presenting this topic about grip strength improving after liposuction. And at that time, when I came up with it, I'd already had about 12 patients that I had seen really nice, improvements on. And so for the year leading up to that, I was able to get about another 6 or 7. So had about 18 patients that I presented on. But the significant thing is about 15 of them had positive improvements in their strength. We did not have measurements. This was subjective, but it was very clear, and you felt it yourself. And when I presented it, it was met with good comments from different colleagues that I met and talked to there. One, in fact, was a doctor who was very busy with his lipedema clinic in Germany, and I asked him, have you seen this? And he says, no, I haven't. I said, have you asked anybody about it? He goes, no, I don't ask my patients. And I said, well, if you don't ask, the patients aren't going to jump out and tell you, guess what? My forearms are better. Mm-hmm. So he said, yeah, I'm going to ask. And that's the first thing we have to start doing. But it was from this grip strength improvement, which, when I talk about what made it significant, well, there's no weight. The weight of the fat right here, we're removing 0.5 pound. And when they're doing this, you're not lifting your arm up. You're just opening, closing your hands. So that was the first clue to me that there was truly a strength component. And since that time that I've been asking all my patients about their legs, if they've had improvements. And we've had tremendous improvements. We've had runners who immediately after getting their lower legs done, the first time they ran, which is about a month later, because we don't allow them to do any strenuous exercise, they go out and they run a minute. They run their mile in a time that's a minute less. Their very first run, running a minute faster. And I'm going to say it wasn't because we took off several pounds of fat. Mm-hmm. We may have taken 5 or 6 pounds of fat.
There's definitely something more to it.
Yeah, but their legs were just stronger. So, and in any case, strength is something, in my opinion, that is a huge factor that causes the fatigue and heaviness. Mm-hmm. But, the other doctors just aren't talking about lipedema affecting the strength in this way.
Mm-hmm. Yeah, and all the other positive benefits that you get from these surgeries, right?
Yeah, and then this leads into the next thing, which I always have to talk about. I'm sorry, but next thing is sensation. So it's almost like a neurologic type of improvement, because what controls the muscles and sensation? It's nerves. So somehow it seems to me that the nerve functioning is improving immediately. But we've seen quite a few patients who also said that they had diminished sensation in their lower legs. One was in their toes. They had lost sensation in their toes completely. That after my liposuction, their sensation came back completely. Many in their lower legs, when they're shaving, they said, yeah, my legs feel completely different. I have sensation there now. I had one patient, her hands, she had such a dense neuropathy that she couldn't feel a keyboard anymore. And she had to stop working in a front office. And after we did her forearms, she was able to feel again. So there is evidence, that I've seen that tells me that sensory function improves, strength function improves, even balance. Patients who are walking upstairs who are saying, I used to have to hold on to the rail and because I felt like I was going to fall. And now I can walk up and I don't, my balance is so much better. So that's a neurologic function too. So
And
I
even
think there's
stance
all
too.
these
Stance
things.
was one that I noticed in mine. Like I looked at my old pictures and my stance, my legs would be so wide. Even the pictures we did on like my before surgery ones at your office.
Wow.
And then you look at my pictures now and my legs are straight. And so, you know, and I noticed that in a lot of patients when they're posting their pictures, their legs are kind of like bowed out almost a little bit. And I'm like, it's like just so many things that we don't even know are being affected by it on a deeper level, right?
Yes. Yeah, definitely.
Amazing. Well, Dr. Sue, thank you so much. This has been so informative. And thank you so much for everything you do for the lipedema community and helping so many of us get back into our bodies and feel like ourselves again. We really appreciate you.
Well, thank you so much for the opportunity to do so. It's been a real pleasure and a life-changing thing for me to be able to not just work on cosmetic patients, but, you know, to make these kind of life-changing treatments for patients. So it's wonderful in my world too. So thank you very much.
Very grateful. Thank you. Thank you so much. And we're going to go ahead and link to everything about you in the show notes as well. So if you're struggling with lipedema and you're looking into surgery, we're going to link to Dr. Sue so that you can check out his practice. So thank you so much.
Thank you. Bye-bye.
Bye.